Hey, welcome back to the 260. It is your host, Kaitlin and Taylor, and today we are talking about something that is hardly talked about, and that is giving the death notice. If you're a first responder, you know how heavy this subject is and how hard giving this notice can be to your patient's loved ones. So today we are talking about how to be honest and compassionate and some tips and tricks to follow when giving this notice and how we can do it a little bit better. At the end, we also go into how we can manage our health as first responders because this is not a simple task, nor is it easy, and it shouldn't be. We typically don't walk away from these feeling great. So with that being said, let's dive in.
We're here today, Kaitlin and Taylor, just us two, and we are talking about what, Kaitlin?
Giving the bad news.
That's too vague.
That is
Could
too
you be
vague.
more specific?
Yeah, the death notice.
See, we're already getting into the lesson right now. Can't be too vague.
No, you cannot. You
Gotta
cannot
be specific.
Yes.
But you have to balance. Well, let's just segue right into it, okay? You have a bunch of information that you'd like to present to us, but we were already starting an intro and it made me think of a question. How do you balance being direct with being passionate when you have to tell someone, your loved one just died? You're on scene of cardiac arrest, you work the patient and the patient succumbed to their disease process. Yeah, how do you balance that? Because you have to be direct. You're right. You can't be so vague. We're playing around in our intro there. But no, you do have to use the word death, dying, dead. But also that sounds so harsh. It sounds so, how do you do that?
So it's going to come down to two things, your verbal and your nonverbal communication, right? So your verbal communication is, obviously what you're saying, and that you need to have a nice soft tone, but how you communicate, what's going on, it needs to be clear. No medical mumbo jumbo, right? And you need to use the words like we said earlier, dead, died, very simple words. And then your nonverbal communication, how you're standing, right? Is your arms crossed? Are you at their level? Are you sitting down? Are you kneeling? Are you standing next to them?
Are you above them? Are they sitting down? Yeah.
Yeah, I'm like, if they're sitting down, please get down on their level because that's shown to be, you have that hierarchy there. It's kind of like the office where your boss has the bigger chair and they're sitting above you and staring down at you, right? So making sure that you're at their level or below in a safe way. And that's how you're going to be direct, but also compassionate. You're going to be direct with your language, but compassionate with how you're presenting it with your body language.
I like it. Good answers. Be direct, but be aware of what you're doing with your body or what you're not doing with your body.
Mm-hmm.
And, what can I do to be as non-domineering or threatening as possible? Not that they would be threatened in that circumstance, but our body language can be perceived as such, especially if you have a uniform on and you got a radio and you got boots on and I don't know, it can be a lot for someone.
Yeah. I'm we look threatening and our body language should not, but our words should be clear and direct.
So what do you have for us today? Kaitlin has done a lot of research. She's been digging. This has been a topic that's been requested. So if you guys have things that you think would be beneficial for us to discuss, or you'd like to, hey, I would listen to that podcast, let us know.
Yeah, we get requests all the time, and we work really hard to get those requests out and finding the right people to talk about those certain topics, right? And then in this case, I actually quite like this topic, so we're gonna dive into this. So giving that death notice, as we all know, in paramedic school, I don't know about you, but I didn't get a lesson on how to give a death notice.
I remember it being talked about, and I don't think they did a bad job by any means, but it just starts to cover it. they basically said, like, be direct. Don't use words or phrases like they've passed on or they've moved on or they're in a better place. Like, that just leaves room for interpretation. And in those circumstances, those individuals they're struggling and they need you to be clear.
Yeah.
And anyway, I remember that, which was good. That was a great start, but it goes a lot more than that.
It does. So the family or loved ones do not believe that they're dead until you tell them that they're dead. So, like, again, using the words like they're passed on, are they expired? Please do not use that. I absolutely hate that word when using in death. But they don't believe it until you tell them. All right. Now, I remember that, like, the same thing. Like, hey, you got to use these words. You got to be clear. Be sympathetic, all that stuff, but you don't really like get into the weeds of it. So as I was like researching this topic, be like, what can we do? Like, how can we be better at giving a death notice, and what are the steps? And as in EMS, we like algorithms, we like steps, we like a thing to cross off, right? A bucket list. So let's kind of talk about it in like that sense a little bit. So step one, now let's say we're doing a cardiac arrest. Okay, classic cardiac arrest. Get there, you start working them. Step one should be, once you get done with all the chaos of that cardiac arrest, you got your epi on board, you've shocked, you're just getting into that rhythm.
Find a groove. Yeah,
once you find a groove, you need to find your key players or your family members, your loved ones, right? And you need to introduce yourself. Okay, you need to be like, hey, I'm Kaitlin. I am currently working on your husband. Currently, right now, we have an IV established, we are giving meds, we are doing CPR, and we have a tube in his mouth to breathe for him. I will update you here in a little bit. I am going to continue to do those methods until we hit a certain point, or have a further conversation about next measures after this next round, right? So you're kind of just introducing, hey, this is what's going on. I'm using simple terms. Don't say RQ3. There's a tube in their mouth.
You have to think about a layperson receiving this information, and although an AirQ3 or intubation might be accurate, but to them that doesn't really mean much. So distill it further.
Yes, and if they can watch it and they want to watch it, let them watch it. They will accept what is happening a lot faster if they can see what's happening. Mm-hmm. Right. And obviously, like, there's some circumstances where they can't, right? Maybe environment, or, like it's out in public and we're in the ambulance, right? And we can't stick them in the ambulance when we're all crowded and they're working at cardiac arrest, right? The other thing I'd like to consider is like the Lucas device. When I had that at Adams, I felt like it was fair to warn loved ones that wanted to come watch the cardiac arrest that the Lucas can kind of look a little intimidating, but it is delivering the best CPR that we can possibly deliver.
Yeah, so there's like a board on the back and then some sort of mechanism for it to wrap around the chest, and it delivers compressions effectively. But as she's saying, it can, what the hell is that thing on my loved one? So yeah, definitely. I think that's a very good point. Like, hey, just a forewarning, this is what that thing is. This is what it's doing. This is why it's there.
Yeah. And we're going to come back after our second round of stuff, kind of update the family, right? If you keep updating them, it makes this process go easier. Now, if during that time you get ROSC, it is very important because we know that we can lose ROSC, and when they get to the hospital, they still might have to terminate later on down the road. It's always good to still instill in the family that it's still a long road ahead, right? That this isn't necessarily, you don't want to give them false hope that, oh, we just saved them, they're going to be good, they're going to come walking out of the hospital all good and dandy, right? You still kind of want to relay that, hey, we got Ross, we're transporting the hospital, but we're still breathing for them, right? Their heart rate is still not good, and then you go to the hospital. But during this time, as you're updating them, you want to check for their understanding, right? You can either ask like, hey, is there anything you need me to explain? Anything I didn't explain? Or you need further clarification. And the reason why you want to do this is it's kind of like a pulse check to see how much that person knows. Like, are they a medical professional? And I don't know about you, Taylor, but, I am in the medical field. I prefer to know, like, what's going on, like, in actual, like, terms of medical terminology. So when someone's coming up to me and saying, hey, you just stuck a tube down their throat or in their mouth, like, I'm like, no, you intubated, right? Like, I want the actual details. So this is like a good way to see what does someone know and how should I explain things going further, right?
Could you give me an example of that you can think of a call or a death notice? You're like, that went really well. And why do you think it went well?
There was this mom, the most recent one that I could think of is the mom, her son just overdosed, and I went in and we called him, like he was a non-workable case, and I identified who mom was right away before I actually went into the house because police already kind of called it. They just needed me to confirm. So she kind of already knew something was going on. I went up to her and I was like, my name's Kaitlin. I'm going to go in. I'll come back up and update you. Okay. I go in, I call him, I come back out, and that's another one where we didn't have a place to like sit, but we were in a nice shaded area. There was no one else around me. My radio was turned down, and I'm like, ma'am, I'm sorry to inform you, but your son is dead. And you could just see like she knew like the tears were kind of starting. I had a pause there, and we're going to talk about that too, that pause. Like after you tell family that, like have that pause. Like you don't need to fix their grief. And that is one thing that we struggle with as first responders is we think, I need to fix this person that is obviously their heart is breaking. Have that pause. Stay with them. Like I stood with her while I watched her process it. The tears started to come up. My one partner grabbed tissues. I handed it to her. I put my hand on her back, and I'm like, I know this is hard. Is there anything I can do for you right now? After a good long, like 5 minutes of just silence. And we talked about next steps. And she talked about her son. And I'm like, tell me a little bit about him. And she talked about him. And afterwards, when we were getting ready to leave, she came up, she hugged me and said, thank you.
It does sound like it went really well.
Yeah. I'm like, considering what happened. But that pause, I didn't leave her. I didn't rush the conversation, right? I kind of introduced myself just because by circumstance she was right there.
I think that you're describing like these tiny little minute changes that can make really big impacts. I think we do a good job in this as an industry. I think that we got a pretty decent beat on delivering this effectively. But I think with a few like little tweaks and changes, we could do a really good job. Just things like that where you just talked like clear language, allowed space for emotion, acknowledged it, and didn't try to wish it away, didn't try to blow it away, didn't try to cover it up. And that individual was thankful, and you turned probably the worst moment in her life into something with, I don't know, I don't want to say a good experience because I doubt that's how she would describe it, but as good as it could go.
Yeah, because this person's going to remember you, right? When you tell them that their loved ones died, like they're going to remember that. They're going to remember who told them that. They might not remember your name, but they're going to remember that nurse was so sweet. She gave me a hug. That paramedic, like they stood by me and they made sure that I wasn't alone, and they handed me tissues, and they didn't say much, but yet like they were there. They're having like a huge adrenaline dump.
Yeah.
Right? Like they're working through it. They are going through it. So they're going to have all sorts of responses. And that response might be, Okay, well, straight into denial and like argumentative, right? That response might be straight into acceptance and, okay, what's my next step? Or it might just be frozen. And we need to be okay with those responses and how to essentially deal with those. If they're arguing with you, we need to understand that we don't need to argue back with them, right?
A lot of times you just need to listen. So the situation you just described, that emotion was sadness, despair, and you sat with it. But sometimes it's uncomfortable. But sometimes that emotion will be anger. It will be a more jarring emotion. And I think it's equally important to let that exist as well. As long as you are safe, and most likely you are, just because someone's yelling doesn't mean you're not safe. Just sit with it. And in my experience, I would say 9 times out of 10, when the individual's in some sort of denial or there's anger involved, if they see you just acknowledging it and allowing them to have that, it passes.
I've not had an experience where someone was angry and yelling, and maybe they threw something where it was like super bad. Always make sure that you're safe. I always tell people to have an exit plan and have
Absolutely.
a partner in crime, right? I'm not going alone to give this notice. I always either have law enforcement, a firefighter, or my partner with me, right? That way if something were to escalate, you're not alone and someone else can potentially step in to like maybe de-escalate the situation. And the reason why someone might get angry with you personally, it might be, mistrust, right? Oh, I don't trust that you gave the right care because maybe you look young. Like I get that all the time. Like I look like I'm 12 and I'm trying to tell a 70-year-old what to do. Again, your body language and how you deliver this will 100% help. And if they are arguing with you, just listen. Listen to them and maybe even state the fact, I understand that this is hard for you. We have done everything that we can possibly do. And unfortunately, it didn't work. And then you just sit in the silence. Like, that is the one thing about this. Honestly, the key is sitting in the silence of, okay, I gave them bad news. I reinforced that bad news. We're going to sit in this.
Something you said, too, made me think if they don't trust you, like, feel them out. I would say meet them where they are. Like, I've had individuals respond very well because a lot of their understanding is based off media and movies and television and things like that, or stories from a friend of a cousin or whatever. So like, well, you didn't whisk them away to the hospital. Like, well, what the hell are you doing? Like, just to calmly explain, like, well, why we did what we did. And I would say, like I mentioned before, I wouldn't go off the cuff with that. Like, well, first we started CCR versus CPR, and then we intubated, and we got IO access, and we administer. Like, you don't have to go into agonizing detail, but just to say, like, studies show that when we resuscitate where the victim is found, where the patient's found, they're going to fare the best. And so we've been trained to do exactly what the ED would do in this circumstance, and that's what we did. And I think a lot of people don't understand that. They think, well, why aren't they in the ambulance? Why aren't you going down the road, lights and sirens? And sometimes that's appropriate, but sometimes it's not. I think knowledge is power, and when you equip them with that knowledge, they're more willing to accept what happens sometimes and be trusting.
Yeah. And just kind of going back into, giving this notice, I was telling you when I was researching this topic, and we're like, okay, what kind of articles are out there? What kind of podcasts can I listen to? Stuff like that. One of the things that I never thought of was asking for consent to give the notice. And I thought this was weird, and I was listening to this podcast, and this medic was talking about how she went to go give a notice to a loved one, and she said, unfortunately, I have bad news. And she had a pause in there, and the wife was like, I want you to wait until my husband gets home. And they waited 30 minutes until the husband got home for her to actually say that their son died. And she's like, I never thought about it, about asking for consent, but that person could not hear what I had to say alone, like they needed someone. How I'd go about that is just simply saying, unfortunately, I have bad news. Is there anyone you want to be around before I continue? They're either going to say yes or no, and they might be frantic when you say that and be like, oh, just give it to me, right? Or maybe they're already start crying because they know you're building up to that, but you need to, again, tell them that they're dead. And one of the things that's actually very important is before you tell someone that their loved one's dead, if there's anything you want them to know before you say those words, you need to say that in the middle of that. Maybe there's like hey, they're still hooked up to tubes, right? We've done the whole gamut. Or maybe there is a crush injury. Their hand or chest is misformed of some way. Like, make sure you kind of say that before you say the word dead. And then also offering them to say goodbye. Maybe that's before we cease efforts. Do you want to hold their hand before we actually stop? Or after we cease efforts, do you come up and say goodbye after we get them cleaned up? That is so important. I've done that a lot.
I think it's important for people's closure. Sometimes they don't want to, and that's fine. But some individuals are very pulled to do that, and you need to give them that opportunity. But definitely give them a heads up, like with what they might see, because it could be jarring. It could be, I don't know, something they've not seen before, and it's kind of like, oh my gosh, that's not how I remember seeing my loved one.
Yeah, and like I said, especially like warn them if there's something that, like you said, that doesn't look like them, disformity of some sort. And, kind of talking about this, so just to kind of synapse, make sure, again, when you're giving this notice, it's not when you actually tell them the notice, it's not the first time you met them. Some circumstances, obviously, it's going to be, when we're calling them on scene and not even working them, like that's probably going to be the first time you met them, right? But paying attention to your body language, clear language, no mumbo jumbo. As far as the medical side, making sure you're saying the words, they died, they're dead. You're checking to make sure they understand, giving them time, right? Like those are like the important things. And then as far as us as first responders, in those incidences where we're avoiding giving the notice because maybe it's a kid, right? We don't want to call those kids on scene, or it's a young adult, right? Those ones are hard, or someone of your age. We tend to do what's called like showcase CPR. We want to do something. We want to feel like we did everything possible. Us as clinicians need to realize we know what savable and unsavable looks like. We know what dead and really dead looks like. And that's where you need to be honest with yourself. Am I doing this because it's really what's right? Or am I doing this so I feel like I did something and I don't have to give that death notice to that parent out there?
Yeah, you have to be very careful. Do not make it about you.
Yeah.
You are not in this job to feel comfortable. Very frequently, you're going to be put in compromising positions that are wildly uncomfortable. But it's also a wonderful job where you get to help people in those moments, and you get to be there with those individuals when they have no one and give them a chance potentially. But don't make it about yourself. Like, oh, well, this is really going to suck to deliver this news, so I'm just going to pass it on to the next person. That's not appropriate.
No. And kind of talking about like not making it about yourself, one of the things is it okay to cry on scene?
Of course.
Yeah. It's 100% it's okay.
Yeah.
It's don't ugly cry by any means. Like,
I'm gonna try not to, but
yeah.
it happens, yeah.
I have given a death notice, and I tell this story a lot. It's kind of the run-of-the-mill cardiac arrest, an elderly couple, husband goes down in front of the wife, and the whole time we're working this arrest, she's holding a cup of coffee. And, I've talked to her multiple times, and she's watching the arrest, so obviously it comes down to, hey, we're at that final time frame where we need to call. And I go up to her and I was like, hey, I'm getting ready to call the doctor to go cease effort. Do you have any questions for me? And she looks me dead in the eye, holds out the coffee and says, but I made his coffee. And I about darn near like just started bawling like a baby at that point. And I even think like my eyes definitely watered, but that's okay. Like this is an emotional thing. Obviously, don't make it about yourself, but it's okay if a few tears drop, right? It makes you human. It lets them know that you also care.
Yeah, and I mean it's a team effort too. So if you are overcome with emotion, which we are all human and that's a part of it, lean on your teammates here. Like, I need to step away for a moment and then do what you got to do and then collect yourself and come back. There's still a job to do. Just make sure that you can still operate. But if you need to step away and do that, that's completely fine. It is.
Yeah. Yeah, absolutely. And talking about like kind of like our health here, you have secondary grief. So for example, after that run in particular, like I was newly engaged, or like maybe we were just in like the stages of planning our wedding. And I remember like getting back to the station and I'm laying in bed and I'm texting my husband and I'm bawling my eyes out, telling him my fiance at the time, how much I love him. And I'm like, I just had to tell this lady that her husband of 50 some years is dead. And she looked so confused and lost. It's okay to have those emotions and to grieve for those people too. Obviously, if it gets to a certain point where you're so overcome with emotion and it's weighing on your heart for a long period of time, like that's when you need to involve therapy. But it's okay if you're like, you spend a day or a shift, the rest of that shift just kind of thinking about that poor patient, that poor woman just lost her husband. That's okay.
Yeah, feel your emotions. I'm a very emotional person, so I could talk about this a lot, but you don't get to pick how you feel. And so I think sometimes first responders will feel guilty for feeling a certain way, and then they'll feel guilty for not feeling a certain way sometimes. Because they'll be like, oh, well, X, Y, and Z happened, and like, I don't know, I feel okay. I just ate a sandwich afterwards, and I had my lunch, and like, I feel like I should be really upset, but I'm not. Like, that's okay. That's completely okay. I think sometimes when we are so engaged in what we're doing and we're in that treatment mode, I think it shifts some of our pathways in our brain for emotions. I'm not a neuroscientist by any means, but I think it's hard to feel deeply when you're doing sometimes, and other times it's not. So, I mean, just take it for what it is. If you are overcome by emotion, or if you have those powerful waves of thoughts and feelings, like acknowledge them and appreciate them for what they are, and text those loved ones after those calls. But also, if you don't, that's okay too. And don't feel like there's anything wrong with you. I mean, you don't get to pick how you feel. That's just not how it works. I wish that we could sometimes, but that's not how that works. And I wouldn't be surprised if maybe you do have some of those feelings and they're going to show up at very inopportune times, and just field them at that time, and that's okay.
I always like using the expression, if we didn't have emotions and we were happy all the time, and I told you something very sad that was happening in my life, and you were very happy and you're smiling at me, I'm not going to think you're sincere and actually listening to me. You might be, but like having emotions and feeling sorry for someone and sad for someone, it makes you human and more personable, right? Mm-hmm. And it kind of leads into the next thing that can happen to us, which is disenfranchised grief. And if you've ever had a moment where you held back tears, that's what that is. This is when you feel like you are not equipped to grieve for something. You're not, like, I don't have the right to grieve for this. And I told you off air, I kind of talked about my father-in-law. He recently passed away this year. I felt like I didn't have a right to grieve. because my family was so, like, this was so heavy for them that someone had to not grieve. Someone had to be strong for everyone. And, like, that's what it feels like for us as first responders. And we push those feelings aside. We say, no, we don't have a right to be sad about this. And this obviously can lead into substance abuse, depression, and all, like, the bad things.
I'm just trying to think about what you said. Because there's times where you have to stifle certain emotions because there is a task that needs to be accomplished, and there's no one else who can do that task. Like, I'm the only medic on scene, and I need to manage this trauma patient or whatever, and it's super messed up. And so I can't acknowledge that. But that sucks when you have to do that. Because sometimes I'm just going to talk personally and candid. Like, sometimes that emotion won't come back up, but it's still there and you feel it. I don't know if that makes any sense at all to you or anyone listening, but you'll kind of have to hide it away for a little bit. Because I got some things I got to do right now. I will deal with that later, and then it becomes kind of hidden and festers and comes out in other ways. And you're like, I woke up and I'm just angry and pissed today, and it's hard to dig them back up sometimes. I wish that we had that space to acknowledge emotion sometimes. At least maybe that's just me because I'm very emotional, but I don't know. I remember several opportunities that were given to me by my supervisors, and I worked high volume 911 where they acknowledged that, I don't know, hey, that could have been really difficult on that crew emotionally, and I'm going to pull them out of service. And I really appreciated that.
Yeah.
And so if any of you are listening and you have that capability or that freedom or that autonomy, man, that was huge. Just giving people space to, if you want to acknowledge what happened emotionally, and you can do that. Also, if you just want to you just want to take a big breath, you want to have a Coke, get a snack, doom scroll for 15 minutes, that would be nice too, just to kind of check out for a little bit. I remember those moments being very impactful for me. And I guess if anyone can do that, then please do that for your crews, because it was pretty huge.
Yeah, it's very impactful.
I like that we're just talking free flow, and now the conversation is morphing into the first responder and what to do for the first responder when you have to do this day in and day out. That can be heavy on someone. You see highly unusual things on a regular basis. I don't remember the statistic, maybe you do, but most individuals see,
it's one traumatic event in their life.
And or the amount of individuals who have died, on one hand maybe, but then it's that's a week, that's a week for an EMT or a medic in a 911 system potentially. And they're a person with relationships and kids and practices and hobbies, and how does that fit into there? Does that screw things up? Does that mess things up? And sometimes it can. It really can. And so you have to think, what am I doing to process all that? And sometimes you don't need it. You don't need to, just because you experience something traumatic doesn't mean you need to go to therapy. No, but you might.
Yeah, it might be good.
Maybe it is.
I was talking to someone a couple weeks ago, and they vaguely asked about my therapy experience. I was like, yeah, it was good. Initially I went for this and it turned into this, yada, yada, yada. And they're like, I don't really have anything hard going on right now, but I thought about just going to just do a mental checkup.
Mm-hmm.
It's yeah, no, that's good. You never know what you're blocking, right? We're very good at that as first responders. We are very good at putting our feelings aside, putting them under the rug, and saying, hey, I will deal with this at a later date. But like you said, at a later date when that time's appropriate, where you don't have kids around and you are by yourself, for example, like in the shower or cooking or gardening, whatever the heck you do, those emotions don't come up.
And sometimes they're difficult to access. I have found that moving my body, I think, loosens things up sometimes. I really enjoy walks, and it is not uncommon for me to find difficult emotions that were elusive when I'm like just walking, moving your body.
Yeah.
It's not like if you see Taylor walking, he's innately sad. No, that's not the case.
No.
I've just noticed that occasionally I've like let go of some things that were really difficult to let go of, even though I didn't realize I was holding on so tightly to certain emotions or experiences. And then, I don't know, there's something, I'm sure someone more intelligent listening probably is like, oh yeah, I know exactly what that is. It's called this, and I've studied it or something like that. But there's some sort of mind-body connection where, I don't know, things just get loosened up and it's easier to process for me personally. So I guess if anyone finds themselves in a similar boat, like try doing something with your body for a prolonged amount of time and revisit those emotions, or not. Like, that's okay too. At the end of the day, you're moving your body. That's good for you.
Yeah, absolutely.
What advice, so personally, as a paramedic, and also just from the research that you did leading up to this, what advice would you give a new paramedic or EMT or advanced EMT or EMR or someone who just has anxiety about this topic, which is totally valid? Like, what advice would you give them to, hey, you got this, you can do this?
So what I would tell them is this is not a comfortable experience, right? You're not going to walk away from this feeling good, and nor should you. And that is okay. It is okay to understand that this is uncomfortable. You're not going to fix the person's grief. And like I said earlier, we want to fix people. So when we see someone breaking down in front of us, we want to fix them. You're not going to fix this. And it's okay not to be good at these at first, death notices. But like we said, we are actually very good at these. We do a very good job. And generally, we all kind of follow these steps of introducing ourselves first, making sure people understand using clear, toned down lingo, right? You'll get there. Mm-hmm. You will get there. Watch some people. Always go with someone that's going to deliver a death notice first. See how they do it. Rehearse in your head before you go and actually give it. That helps. I've made that mistake before where I did not and had stupidly said something in front of a family that, like, I probably shouldn't have, right?
Yeah. Like you said, bringing a person or talking with another individual about it. Like, I can think of several individuals who are very good at this. Like, watch them. What did they do? And what did they do well that was different? And emulate that. Have a conversation with them. Have them come with you. Don't be alone. Yeah, like, even if it gives you anxiety, like, have someone go with you. That's okay. I remember I was given a notice to an individual and my volume was on my cell phone.
Uh-oh.
And during this, I don't know why I decided to have a ringtone. It's like it was 2007 or something. And I was like, oh no, I'll just get a ringtone. Anyway, and the ringtone I had was a very silly song. And just because in the moment I was like, oh, that'd make me laugh every time if someone calls me. But someone called me during a very inopportune time, and I remember feeling so stupid and so unprofessional and just like a freaking idiot. Now, granted, nothing terrible happened, and the family was cool about it. And but make sure your phone's off. Make sure your phone's on silent. It's in the rig or something like that.
Your radio's down.
Yeah, turn your radio down. I mean, you talked about at the very beginning. Make sure you don't have loud, distracting things going on. But yeah, turn your volume down.
Yeah. I mean, is it worse than my Under the Sea ringtone that always plays?
Yes.
Oh, man.
For those of you who are curious, yeah, I didn't want to say it because it's going to make me look bad, but you know what? It is what it is. We're human. It was the song The Pit by the Parks and Recreation character Andy Dwyer it's like this mock Pearl Jam butt rock anthem, and it was just bad. It was very embarrassing, and if you don't know what that song is, look it up and then you'll cringe for me. But yeah, turn your phone down. Right on.
All right, guys. Well, until next time, leave it better than you found it.